Good morning. I'm not a very early morning person, but I still hope to give you the impulse needed on patient engagement. If I can first give an impulse with a device. I don't know who regulate them, but this one works. Okay. So first, I think it's important to remember that we cannot take for granted that in all jurisdictions, the authorities work with the civil society as we think it should be done in modern times. I just took the example of this international scientific organization that assesses the risk with climate change. It's 193 member states, so maybe the most complex scientific organization, with large, high numbers of civil society organizations that are completely part of the scientific work. It's more than 140 civil society organizations that are involved in all subgroups of IPCC. And this is not questioned. I think it's accepted by everyone that only because civil society is in this scientific organization, then the public can trust the scientific outcomes of their work. And the same at the EMA, where each year more than 1,000 opportunities, patients are part of the activities, and that really helps building trust in the public opinion on how the agency regulates medicines. And so the civil society, the patient representatives in particular, they can understand how technologies are assessed once they are part of the process. And that's already the first goal, to understand how these assessments are done. It's even better if patients can contribute, but even to witness how these assessments are done is a major achievement. Speaking of HTA activities, I think patients can be involved in all types of HTA activities. All patient groups that are organized to follow the development of technologies of interest, all patient groups, one way or the other, look into the pipeline of technologies developed for their disease. They have different methods, certainly completely different from HTA experts who also do some horizon scanning. But we as patients, we have our own criteria to prioritize which products seem of greater interest to the patient community. It would be excellent if we could share views with HTA experts when scanning the horizon to verify that our priorities match and maybe to enrich the horizon scanning with criteria that are relevant to patients. In the HTA joint consultations and early dialogues, we've had excellent case studies where patients take part in the scientific consultations jointly with EMA. The scoping, at least to verify that patients agree with, for example, the PICO that the HTA experts have defined, that in itself is a success to make sure that we have the high-quality dialogue to verify that the PICO as defined match the expectations of the patients. But they could also have other PICOs than the one proposed by the HTA experts, and we need to organize this dialogue before the HTA assessment starts. During the assessment, certainly we need to think on how patients contribute to the assessment. Not all of the assessment, but for example, by providing additional data, additional views from the patients, by performing their own patient preferences studies and sharing these studies with the HTA experts, many things that we will discuss this afternoon. For the appraisal, it's still in parentheses because I don't think this is very common in our countries or in other countries. But also then the updates when new evidence emerges or when technologies become obsolete, again, we need to involve patients in these discussions. So there are different ways to organize these interactions. So via the PICO, where we know that patients can respond by interviews, by questionnaires, or participating in meetings. We still have to set the process. For example, is there a first kickoff meeting where the entity which knows the technology the best, that is the developer, first presents what they know about the technology, and then HTA experts on their side and patients on their side brainstorm about the PICOs that need to be answered to, or other ways. And it should really be a two-way interaction, meaning that it's not fully satisfying if the interaction is based on a document you sent to patients and getting their responses back. That is not really a dialogue, the dialogue that we would want to implement. And I think this is what we need to achieve, because I said before, not everyone is convinced by the need to involve patients in all activities. We need to demonstrate the utility. We need to demonstrate the positive effect, maybe some negative effects. We need to face the challenges, but we need to measure the impact. And for this, we need to make sure, because for many patients, when they will be consulted, when they will take part in some HTA activity, it may be their only opportunity in their lifetime as patients to contribute. So most patients will not know all the details of HTA, will be process and content naive. It will be the first time that they can discuss a technology with HTA experts. So they need to be accompanied in this process, either by the HTA cooperation or HTA agencies themselves, or by the stakeholders, the patient organizations who would like to be part of this cooperation. And we also have the experience of preparing patients to scientific consultations. And these are all the steps. None of them is easy. First, to find the experts. It's not only in rare diseases that there are difficulties in finding people, because for all patients, when it's the first time they take part in a scientific assessment, it's extremely intimidating, and we should not underestimate this aspect. To prepare them, to explain them the procedure, what is expected from them, to help them navigate through the scientific documents that they receive, to involve them, sometimes to accompany them to the meeting. And without influencing them, it's really to help them to forge their own opinions based on what they read, and then to help them elaborate the input and to acknowledge the input and to measure the impact of this input. And I thank you for your attention. Just to finish, the CIOMS, the Council of International Organizations in Medical Sciences, just released a report on patient involvement in the development, regulation, and safe use of medicines. And this report, these conclusions apply universally to all world regions. I hope one day we will have an equivalent in HTA, how patients can be involved, the successes, and how to organize it in all countries where HTA assessments are done. Thank you.